And now to tonight's guest, Professor Patrick McGorry will soon end his term as Australian of the Year, but he'll no doubt continue to speak out about what he sees as chronic underfunding of mental health services. In a speech he'll deliver on Monday, Professor McGorry says mental health remains one of the defining tests of this government's credibility. It's a test the Australian community are willing the government to pass. Patrick McGorry joins me live now from our Darwin studio. Patrick McGorry, welcome to Lateline.
Thanks, Steve.
If, as you say, mental health will be one of the defining tests of the government's credibility, what does it have to do to meet the benchmarks to pass that test?
Well, I think what the government has to do is commit to ending the inequity between physical health care and mental health care in this country. It's a fundamental principle of equity, and what it means on the ground around the country is that approximately 1 in 3 people with mental ill health get access to care, compared with the vast majority of people who experience physical ill health. So this is a kind of an apartheid that's characterising our health system, and every day we see the gap widening, not narrowing. The government has committed in its second term to addressing this issue, but the government has been in power for 100 days and we still have not got a commitment from the government. So
are there any signs at all that the government will pass that credibility test, as you put it?
Well, I'm very hopeful. We've had some very positive interactions with the new Minister for Mental Health, Mark Butler. He's the first Australian Minister for Mental Health, so that's probably a signal that the government is intending to take the issue more seriously. But the Prime Minister, I think, needs to support this new Minister very, very strongly in this current environment, because the scale of the problem is incredible. We are billions of dollars each year short of that equity goal. Mental health in Australia constitutes 14% of the health burden, but it attracts 6% of the health funding, and that translates into a multi-billion-dollar expansion that's required. And it needs to begin in a stepwise way from the very next budget.
You made the point there that the government has appointed a mental health minister for the first time, and Mark Butler says in the first weeks of him being that new minister, he's been engaging with the sector and that he's working on options for future reform. Is that fair enough, that he's only just taken over that portfolio and that he's engaging with the sector?
Yeah, look, I think we're very pleased with our discussions with the minister, but the absolutely clear thing we need to say about that is the blueprint is already there. The National Health and Hospitals Reform Commission came up with 12 very clear evidence-based recommendations about stepwise reform in mental health. That's at the minister's disposal, and it's fine for him to talk to the field and get to know all the relevant players and the organisations. That's terrific, and he's actually understanding the basis for the reform, and I think we're confident about that. But he and the government need to make a commitment, and we want to see the Parliament really look at this issue very seriously in the next period.
So are you saying the time for talk is over?
The time for talk is definitely... The time for talk was over some time ago, and what we need to see is not more of the same. There are several big missing elements in 21st century mental health care in Australia. The first being the focus on early intervention in teenagers and young adults, as evidenced by the Headspace and EPIC models, which are top of the list of the Health and Hospitals Reform Commission's recommendations. And secondly, as well as turning off the tap in terms of future disability and premature death, we've got to clean up the mess after the failed institutionalisation policies of the last decade or so, where so many Australians affected by persistent mental illness are marginalised, homeless, lacking a decent place to live, lacking a future in terms of jobs and meaningful activities, and also the lack of community mental health services. All that's provided on the ground in most states in Australia is acute, band-aid sort of care, which just deals with the crisis and returns people back to the really quite marginalised existence that they face.
You handed your own report to the government just before the election that was suggesting $3 billion be injected into mental health over 4 years. How did the government respond to that?
Well, we haven't actually had a response yet. I think that this is based on the Health and Hospitals Reform Commission recommendations. It had the support of 61 organisations around the mental health sector in principle. There's tremendous unity and cohesion in the sector, which I've never seen before. There's tremendous support from the Australian community. The survey published in The Australian last week showed that 35% of Australians rate mental health as one of the top 3 issues, along with climate change and the economy, compared with 10% of people in the US and in Europe. So Australians get it. The public are onto this. It's the government that really needs to get with the program here.
So why hasn't the government got with the program, as you put it? Is it a matter of money? Do they not have the money in the budget?
Well, I think one of the problems may be that they've locked themselves into this straitjacket of financial responsibility on this particular issue. It doesn't seem to apply to other issues such as wars in Afghanistan, building new detention centres, and anything that requires an immediate decision. And I think certainly when $7.4 billion were dumped into the acute and primary care sectors, that money didn't seem to be a problem in that area. So I think it's very convenient to use that excuse, but I don't think the Australian people are going to accept that.
Will waiting a bit longer as the new minister consults with the sector and with the community have any adverse effect?
Every day there's delay. More deaths occur from untreated or poorly treated mental illness, and more lives are thwarted or blighted as a result. So, of course, delay is important, and it's inexcusable when the plan is clear. Now, I believe the Minister's acting in good faith. He's approached the task constructively, but he needs the support of his colleagues on the Labor side of politics, particularly from the leadership. It's vital that that's accessed and tapped into. The Prime Minister's on the record as saying that she will provide that support. I just want to know, on behalf of the sector and on part of the 3.2 million Australians this year who have suffered mental ill health, when is that going to happen? We need a deadline. These people have waited for far too long.
The motion that's due to appear before the House of Reps next week is calling on the government to take action and to, among other things, roll out early intervention centres for young people across the country. But hasn't Labor already announced the first wave of these centres?
Well, the positive sign is that Headspace, the primary care version of that, is in place in some communities in Australia. It needs to be strengthened and rolled out much more rapidly than the current plans propose. But probably the most vital part of that reform is the backup system, which is called EPIC, or the early psychosis model. Now, these Headspace centres can't function without specialised youth mental health services dealing with early intervention for the more complex and severe problems. And the current government allocation for this will only produce a cardboard cutout version of that, which actually will do very little good and probably discredit the whole approach in the process. So it has to be properly funded. The Coalition's motion has got accurate costings in it. Now, this can be phased in, so I think there's a way of doing this and allowing other investments in mental health to occur in parallel, because I think there are 2 areas we need to focus on, the front end and the longer term.
The Coalition's motion has already passed the Senate, but the Greens and Labor both voted against it. What does that tell you?
Well, I think the government obviously isn't ready to embrace it, and obviously it would be preferable if the government took the initiative and actually took the high moral ground on this issue and got us to a tripartisan position. The Greens are very supportive of mental health reform, and it's just a matter of detail, I think, about where the emphasis is.
Are you surprised the Greens didn't support? Are you surprised the Greens didn't support the Coalition's motion, because these centres, these early intervention centres, are aimed at young people who are basically the target voters for the Greens?
I think the Greens are very supportive of early intervention for youth, and particularly for a proper implementation of the EPIC model alongside Headspace. But I think they do want to see other things happen as well, and so do I, and so does the whole Australian community. So I think we've got to do more than one thing, and I think that we will get to that position. In fact, the early intervention and youth mental health focus has got tripartisan support in a policy sense. Where we're lacking is in the investment and the reality on the ground.
You've been touring the country in recent months as Australian of the Year. In the various states and territories you've been in, have you seen anything that's given you cause for optimism?
Well, the big thing that gives me cause for optimism is the tremendous community-wide support for investment and reform and a 21st century standard of care in mental health. And that's coming from the Australian people, from the grassroots, from everyone that I've met in the community across the whole country in the last few months. It's also coming from every level of society, whether it's bureaucrats, policy makers, people working in all parts of the health and social sector, and indeed from all sides of politics across the Parliament. Where it hasn't quite penetrated yet is at the top level of leadership, and that's what we need to see slot into place and make this a reality. And it's not going to be a one-off. It's not going to be something that's a single budget flurry. We have to see a progressive scaling up of mental health services over the next 5 to 10 years so that we reach this target of equity in healthcare, and that people will not experience this apartheid type problem when they come with one type of problem, being a mental health problem, versus another type, such as a cancer or a heart attack or something like that, and where they receive Rolls-Royce treatment compared with absolutely second-class care in the other area.
What about in remote Indigenous communities? I mean, it must be hard to know where to start in those communities when you've got alcohol and drug abuse, you've got lack of employment, you've got suicide rates higher than the rest of the community, and then you've got a lack of facilities, remoteness as well.
Yeah, I think that's quite true, and that's the reason that the suicide rate is substantially higher in Indigenous communities, reflecting a much worse mental health situation in those communities. But it can be approached in a multi-component way by tackling the social determinants, which are obviously going to impact on a whole range of health outcomes, but also making services available in a culturally appropriate way that will be trusted. It's the same issue as with young people. Make the services acceptable and engageable so that they actually get to first base, and then having some real expertise to offer people so they can actually make a good recovery from these very treatable episodes and forms of mental ill health.
The Prime Minister has a personal connection with this issue. Her father worked for a number of years as a psychiatric nurse. Do you think that she has the will to drive the kind of reforms that you want to see to the mental health sector?
Yeah, well, I'm very encouraged by that fact, and also by the fact that she's visited our service in Melbourne when she was Shadow Health Minister. I think, like Mark Butler, she's intelligent, she understands the issues, she's engaged with them, and it just comes down to a matter of politics, leadership and vision. And her comment yesterday about the kind of Australia that she wants to see is one where there's equal opportunity for everyone. Well, I'd like to see equal opportunity in healthcare for people who experience mental ill health, and that's 3.2 million Australians every year.
Patrick McGorry, thanks for talking to us on Late Line tonight.
Thank you very much, Steve.